talking about how complicated it is and there is potential for fraud. But the reality is time's ticking. And there are people who are really going to suffer because the system is the way it is, unless these are at least extended temporarily while you try to figure out a reform. Will that happen? Will you encourage the president to do that?
There are ways for us to continue to cover Americans without allowing the widespread fraud. And I don't want to underplay this. 4.4 million people right now, we believe, are getting full insurance coverage with the Obamacare. Many of them don't know they have that coverage. They're duly enrolled both in Medicaid and the ACA.
Can you fix that? It's the middle of November. Can you fix that in the next 5 weeks?
Well, we can definitely put in incentives to remove that as a possibility. I'll give you a good example. Get people to pay $5. $5. Is that too much to pay a month? Paying $5 a month means at least you have to opt into the program. You can't get falsely put on the program by some broker without you knowing about it.
So are there conversations about doing things like you just said with the Republicans in Congress, maybe even with Democrats, in order to get these subsidies at least extended in the short term?
There are discussions around extending the subsidies if we deal with the fraud, waste, and abuse that right now is paralyzed in the system. There are ways of using our money wisely by putting it in the pockets of Americans. There are things we actually put into the One Big Beautiful Bill, like these CSRs, which are these cost-saving reduction tools that make insurance more efficient, that would have saved us a lot of money that Democrats took out. So there are already ideas we've put out there. We would have saved 10% on premiums if we'd allowed these CSRs to be enacted in the One Big Beautiful Bill. By not putting them in there, we're forcing people to pay more. Dana, the big question is this: how do we insure people but make it sustainable? I'm passionate about this. I'm a heart surgeon. I want people having coverage when they come to see me for life-saving heart surgery, or else I'm fearful they won't get that care. But how do we do it in a way that makes the program sustainable for decades to come? So we don't fight this battle every single year?